Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today, I'm speaking with Dr. Diane McIntosh. Diane is a well-respected psychiatrist, an author, and chief neuroscience officer at TELUS. Today, we're talking about burnout, what it looks like. How do you know if you are burnt out? And Diane also speaks about her own experience with workplace burnout. I hope you enjoy the conversation. Hi, Diane. It is great to see you again.
Hi, how are you?
I'm really good. And I'm looking forward to this conversation because we're going to talk about burnout in the workplace. And I think that it's an interesting conversation now coming off of, the last 3 years where a lot of people were working from home and work life was very different and all those sorts of things. But before we kind of get into that, it's hard for me to believe that you haven't always been balanced at work, like that you've experienced burnout yourself. Because, I just think, oh, well, you're a doctor and you get to decide what you get to do and how many patients you see and how could you possibly be burned out? But I mean, everybody is vulnerable to burning themselves out, aren't they?
Yeah. The way you described it when you started to me, I was saying that it's work burnout or workplace burnout, but really burnout is by definition a workplace issue, right? Yeah. So it has to do, and whenever someone struggles with their emotional, their energy or their emotional state, of course, it's usually blamed on the individual, but it truly is related to the organization, the situation you're working in. It doesn't mean that the person who gets burned out doesn't have any responsibility for it. And it's really critical as you're trying to figure out what's going on with you to reflect on what role you play in the situation. But it really is important to recognize that this is a workplace disorder. It's not a mental illness, but it is a change in your behavior and your feelings and your general sense of well-being related to workplace issues.
Okay, and we're done the podcast because I had no idea, Diane. I thought burnout was like when you just feel super exhausted in life.
That's part of it. And certainly feeling emotionally exhausted is one of those core features of being burned out. And sometimes when you're emotionally exhausted, you can also feel physically exhausted or slowed down. So exhaustion is one part of it, but this sort of declining sense of your ability to accomplish things. So you feel like you're less effective in your role, as well as this sort of mounting cynicism, a sense of not really feeling like you're working towards something, that the system becomes, or the organization becomes quite negative. And you know that if something doesn't change, these issues are going to get worse over time.
Okay. Well, now that we know what burnout is, and you have experience with burnout yourself personally. So maybe you could explain that to us. Like, what was burnout like for you?
It came on sort of slowly and insidiously. And I will say, as a psychiatrist, the thing I loved most was seeing patients. If someone had told me 10 years ago, you're going to become burned out and it's going to be really, really, really hard to see patients, I wouldn't have believed them, because it was the thing that was most energizing. It drove me. It was my thing to be able to help other people and to have this special area of expertise around using medication safely and appropriately. And I am the queen of hope, right? There's always a path ahead. I've never said to someone ever, there's not a next step. There's always a path ahead. And so to get to this point of, it was just so hard. It was like trying to walk through huge snowdrifts all the time. And it just wasn't me. Why was it so hard? I didn't understand. But once I learned about burnout and understood that this was related to multiple issues within the system I worked, it wasn't my patients, certainly, who are almost universally wonderful, but not feeling safe within the system that I worked, not feeling like if I had to send a patient to hospital that they were safe, not being comfortable with the kind of ecosystem I was working in. It wore me down.
Okay. So I mean, and I did start by saying the last 3 years have been interesting for people working. So if you work for, a big corporation and the last 3 years you've been at home working, and now you've got to go back into the workplace. I mean, do you see the potential for burnout in that situation for people, like being at home, which for some people is very relaxing at home. For other people is not at all. It's very stressful at home to have to do that. Do you see the potential for burnout in people as they return to the workplace in-person working? Is that what it's about? Or is it more about the system of your workplace?
So burnout is generally associated with professions where there is a lot of pressure, where other people's needs come first. And that's why in medicine, it's a huge issue. So there's high demands. There aren't enough resources. There's a disconnect between the workers' experience, their expectations, and their experiences. So I think, I'm a psychiatrist. If I think a patient is ill enough to go to hospital, I'm the expert. I'm at the top of the pile for mental illness, and I'm worried that that person is at risk to themselves or others, and I send them to the hospital and they get sent away because the person doesn't think that they're ill enough when they don't know anything about that person. That is a situation where my expectation of my expertise and where I fit in this whole process is undermined. And, it undermines not only my confidence in the system, but my patient's confidence in me and in the system, and their loved ones' confidence in me and in the system. So I know I'm not alone as a healthcare provider, right?
No.
So back in, I think, 2017, the Canadian Medical Association, 2018, they did a survey, and they found that around 30% of clinicians, of physicians, were struggling with high levels of burnout. I think 2021, we were in the midst of the pandemic, and it was over 50%. So what's happening is people are just becoming burned out because we have such awful system issues, and they're walking away from the profession. And it's not just medicine. We're seeing it in nursing. We're seeing it in every area in the medical field.
Mm-hmm. So, I mean, the healthcare system is your area of expertise. And for anybody who's a patient, I think that it can be, I'm not an expert when it comes to healthcare by any means, but I can watch the news, say, and see, people in positions of power talking about how things are great and nothing wrong, and patients are being seen and operations are being done, and hey, don't worry, everybody, it's all fine. But if I talk to my friends who are working in the healthcare system, whether they be a GP, a surgeon, a nurse, somebody who works in the foods in the hospital system, whoever it may be, they have a very different experience. They have a very different story. So I would think that being one of those employees, like, I find it upsetting when I'm watching the news and I see people in positions of power maybe not telling the truth or making it seem better than it is. I can't imagine how that feels as an employee to see that.
I think that there's more and more recognition of the fact that things are broken. But for a very long time, people were just not willing to admit how broken things were. And, one of the things that came out of the pandemic was actually people being able to see what was going on in seniors' homes, right? It just opened the curtains on what, as a healthcare provider, I knew that there were abuses, that people were not being adequately cared for. And it wasn't until we have this worldwide pandemic that every Canadian gets to see what's going on. And now, as well, with the pandemic and its impact on healthcare, and mental health care, more and more people are starting to realize we have an entirely broken system. And if we think our healthcare system in general is broken, you should see mental health care. People cannot get care. Children wait 2 years to see a psychiatrist, when for psychiatric disorders, time is of the essence, right? These disorders progress and they cause functional impairment and brain changes starting early and growing over time. So we need to get in there early. Well, you can't. There's just no one to care for people.
No, there's not. And I think that you're right. People they know this now, right? And I think it was broken wide open over the last 3 years in many ways. I'd also say, we're talking about healthcare as an example here, but I would say education is probably very similar to healthcare, where you have, thousands and thousands of teachers and education assistants and principals and vice principals and receptionists and custodians, like all these people that work in the education system, and they're short-staffed and they're burnt out. And they're, fighting for, safer air in their schools and, masking when they know that, or whatever it might be. And it's falling. It's just falling down. Nobody's listening to them. That would be burnout, right? Where you're feeling frustrated as an educator because you know what your classroom's like. You know the children that need the attention, special attention or extra help with something or whatever it might be, and they're not getting it. That would be awful.
And again, it's a system problem. You recognize as a professional, whether you're a teacher, or a doctor, or a nurse, or a librarian, you're the expert in your area, and you're recognizing that the basic tools of your trade are not available, that you don't have the supports you need, whether it's classroom size or referral sources as a clinician, whatever it is, that we have some really challenging systems. So it can be across the board. I guess because of my focus, particularly in medicine, and the fact that the most vulnerable individuals in our community are the ones that are suffering most significantly: young people, people who have serious mental illnesses, and the elderly. And we have an aging population on top of it. So unless we create some change here, well, we're just not it is not sustainable the way things are now. And the way that change happens is not by me writing op-eds and being on this delightful podcast. The way it changes is by people voting, by people demanding a couple of doctors complaining about something is not going to change things. This has to come from an educated electorate who demands change, who complains because their child cannot get care. And unfortunately, when you're in a vulnerable population, you're suffering from mental illness, or you're an elderly person, you don't have the capacity to speak out often. Right? When you have a serious mental illness, you're the most vulnerable for a reason. And so we have to speak out for those who don't have a voice.
Yeah. And so, it's interesting that you say that, Diane, because, in my experience, I have a son with a disability. And so, he's now in grade 10, and I have a large community around me of parents who also have a child with a disability in the school system. And it always feels like nobody's listening to us, always. And there are a lot of parents that are way too scared to talk because, you live in fear that your child won't get what they need. And I think you can draw that straight line over to healthcare too, right? Where if I'm complaining about, my father who is getting cancer care, say, I don't want to complain about that, because what if he doesn't get his next appointment? Or what if they're just like, oh gosh, he's a troublemaker, or whatever it might be. And I mean, that also would put you in a place of emotional exhaustion. You feel like you're not accomplishing anything. You're cynical, right? Cynical of the system, cynical of the people in charge of the system. And I know you say, I mean, I agree with you. Our power is in our vote, right? Except that we don't really seem to get out and vote whenever we have the chance. It never gets higher than, whatever percentage. So what do you say to people in the short term, right? Well, there's not another election for a while here. What can someone do to start changing their work environment in order to make it work for them? What can we do to,
Tamara, can I unpack a couple of things that you asked me before then? Because or in your soliloquy, that were really important comments. Like you crystallized so many important issues in my mind around system challenges. Being a mother of someone who has a disability, you are amongst the most powerful individuals in our community. Parents of disabled children or children with disabilities have changed the world in so many ways. And while it saddens me that you still feel that people don't hear you, those men and women, those parents who have sort of carried the torch. And one of my very best friends in Nova Scotia, she had a child who had who was hearing disabled, and she changed a system by just being doggedly determined that she was not going to allow her child to be sidelined. And so that is an example of how raising your voice, creating a community, and demanding better does create change. And it's not perfect, as you just said, because it's still frustrating. But think of how far we've come in the last 10, 20, 30 years. It's remarkable. And it's because of the voices of people like you. But you did bring up a really important point around when I was very frustrated about a lot of things that were happening within our mental health care system. I did start writing op-eds, and I did start complaining and doing grand rounds and talking about some of these issues. And what I learned very quickly was that my colleagues generally supported what I was saying. They would agree, they'd high five me or send me a little email, nice job, but no one would speak up with me.
Exactly. Exactly.
It takes courage to speak up when you're afraid there's going to be retribution.
Yes.
And that's what I found. And I think that actually intensified my sense of burnout, was the fact that I felt alone. I was in a community practice. I was very upset with the fact that we weren't getting any medications covered. No drug will work if it's not taken. And yeah, I can get all the crappy old drugs that cause you to lose your libido and gain 50 pounds, but I couldn't get any newer agents that really people tolerated better. So I would complain about this and no one would stand with me. And that undermined me. And the other piece you brought up is compassion. The fact is that when you become burned out, you lose compassion. And that was painful to me, to feel less compassionate about my patients.
Yeah.
And they experienced less compassion when they would go to the hospital or see my colleagues. And that's now missing from our healthcare system. And the reason patients are afraid to speak out, is because they're not met compassionately, and it builds fear.
100%. Everything you've just said is exactly true. So I did ask you after my little rant there about a whole bunch of things, how can someone start to change their work environment if they're feeling this burnout, if they're listening to this going, oh my gosh, I think I'm feeling burnout. So what can I do? I need to keep my job. I need to get paid. What am I going to do? How can I change things to make it work for me?
So I am in a very, very fortunate situation where when I recognized this about myself, I could make a change. And so I pulled back on seeing patients. I wrote a book. I did a bunch of other things. So I was able to find another path for myself, but I absolutely recognize that not everyone is in the same situation. So I know I've talked to you about this before, Tamara, but in that book, I wrote about the 3 gifts that I gave myself as an adult. And one of the most important in this context, and certainly one of the most important gifts of my life, was this recognition that the only human being on earth I can control is me. So I can control my thoughts, my feelings, my behaviors. And if I couldn't, I would need some cognitive behavioral therapy so that I would be able to recognize that and then change my thoughts and feelings, behaviors. And human beings have an enormous capacity to change, which is why I always have hope, because there is always that opportunity to change. But if you're burned out and you're in a system that you can't get out of, all you can do is control you and how you respond. And because you can't change that whole system on your own. I would say that for me, the most important thing was actually recognizing what was going on, that, I knew I didn't have a mental illness, but I knew if I kept going in the circumstance, I was going to get depressed and anxious, and I didn't want that to happen. So I needed to create a change for myself. So recognition was the first thing. And then I had to have a state of the union. I had to make a plan. What are my values? What's most important to me? What matters most to me in my life? And then make a plan based on those values for how I was going to make change.
Right. And I wonder how often, people do that. And I say that because, I worked at the same place for 22 years, and I think maybe a few times in there, I was like, okay, what do I want to really do? And but that's a luxury to be able to do that, to be able to stop what you're doing in your job and go, am I happy? Am I not happy? Because a lot of times we're just trying to, power through and work and then get home and work and get home. And I was single for so long, so I was on my own and didn't have any responsibilities. And I think that was a luxury. Does that make sense to you? A luxury that I didn't have to worry about other people in my life that I was supporting, because there were no people in my life I was supporting. I was just me, and I was able to go, am I happy? Am I not happy?
So I would agree with you. And as I said, I was in a really important situation, not important situation. I was in a world where I could create change for myself. Right. And not everyone is in that position. Exactly. But everyone has an opportunity to reflect on where they are and how they're living their life based on their values and decide, is this what I want? So what's most important to me is my family. And, actually, young people today, one of the major reasons why we're having trouble getting enough family practitioners is because young people who are coming into the practice of medicine do not wish to work 95 hours a week, right? They want to have work-life balance. So we need to make more doctors and we also need, nurse practitioners or physician's assistants. We need to actually change our healthcare system because people want to live a more healthy life. They want a more balanced life. Young people value experience more than money, generally. I know that's a sweeping generalization, but when you look at millennials compared to baby boomers, they have different priorities, right? So I think what's important here is that whatever situation you're in, that doesn't mean, even if it's living paycheck to paycheck and having some significant challenges, that your values go out the window or what's important to you goes out the window. And I'm not a big, New Year's resolution kind of person, because when you set yourself up like that, they tend to fail. Yeah. But once a year, having a moment of personal reflection where you think, is what is most important to me, what's driving me every day? And sometimes what's most important to you is being able to feed your kid and keep a roof over your head. And so I'm not suggesting that we all have the luxury of that, but there is an ability at the same time to say, am I being the best person I can be? Am I living the values that are important to me? My integrity, even if you're making minimum wage and day to day it's a struggle, but I have my integrity.
Mm-hmm. So because your whole point is that the only person you can control is yourself. You control your thoughts, your actions, you're controlling this. So of course you should be having this talk, and not of course, but you know what I mean? If you're not going to have this talk with yourself, who is?
Probably no one.
Right?
Yeah.
Right? It's not going to be your employer. It's got to be you. Yeah, I think that's so helpful. And we forget to do those things, especially when we're busy and we're trying to make ends meet, and we're trying to keep it together, and we're coming off of, 3 years of, I like that advice. That's very good. And a good reminder, because I think sometimes we forget that we're all actually the same. We all have the same fears, and all of us, none of us want to be burnt out. I don't know anyone that has said, you know what, I think I want to be burnt out this year. No one has done that. You know that on this podcast, we like to thank our guests for being here by asking them to choose a Canadian nonprofit. And you chose the BC Schizophrenia Society. And they support families affected by schizophrenia and other serious mental illnesses in British Columbia through education, advocacy, and research. And we will be giving them $500 to thank you for being here. So thank you for choosing them.
Thank you so much. And it's another example. We talked about you being a parent of a child who has a disability. The parents, the loved ones, the supports of individuals who have schizophrenia are also a powerful group, and just work so hard to educate the public, educate colleagues, educate the world about and support research around schizophrenia, which is a very misunderstood disorder. So thank you so much for offering that support.
Yeah. And I mean, one day we're going to do a podcast on schizophrenia too, so we can learn more about it. So what about boundaries? Do setting boundaries, or like for yourself, or maybe for your employer, if you can, does that help with burnout?
Yes, and you actually brought up a really good point earlier on, but you and I both like have these topics that are in our brain. So thank you for reminding me about that, because one of the things that's happened as so many people work from home, and I've been at home now for 3 years and have seen patients in my office, my home office, virtually since before the pandemic. And so what's happened with all of this technology that in many ways has been incredible in advancing human society, has also had some really major drawbacks. Back in the day when I was a young one, once you were finished work, that was the end of it. Nobody called you. You didn't have a cell phone. We didn't have internet, believe it or not, in the beginning. And so now there's no end to work for a lot of people. And it is essential. And it's actually part of, I lead a team now, and we are explicit in the rules of our team. Every member of our team wants a compassionate culture. And so we write down what are the factors that make a culture compassionate. And one of them is having strong work boundaries. We don't email at night. If something's urgent and you must reach out to someone, there'll be a phone call or a text message. But otherwise, when someone's done for the night, and I'm lucky to be able to be in that situation, that's it. Yeah. And so being explicit about those rules is important. And what's happened when people are at home, they're not leaving their workplace. They're at work all the time.
Right.
They have their phone, they are by their office, and it didn't used to be like that. And I think that's driving burnout for some people.
Can you recover from burnout? I mean, well, let me ask you this before we ask if you can recover from it. If someone's listening right now and they think, well, am I tired or am I burnt out? Am I, what am I? And at what level? Is this something that, if someone's questioning their burnout, is this something that they figure out on their own? Or do they need a professional to help them figure out if they are burnt out? And I mean, finding a professional to help you would be very difficult in this day. So maybe we should start with that. Like, if someone's wondering, what do they do? Or if they're concerned? Well,
first of all, it is not a mental illness to have burnout, right? But it's a constellation of symptoms or experiences with feeling exhausted and the frustration, the cynicism, the loss of compassion, the frustration. You can read more about this. There's lots of great, I have posts on burnout. There's a book about burnout. And I think you're going to interview someone about that. So there are good educational sites where you can learn more about burnout and reflect on that. If you are concerned that maybe you're having anxiety, you're depressed, your mood is impacted, so it's affecting your ability to function, always critical to go and talk to a family doctor, go to a walk-in clinic, see a nurse practitioner. They can do some clinical scales and determine, yes, you have depression. Yes, you have anxiety. There's something else going on, and then help you to figure out whether talk therapy would help. There's different ways to do that through books, through the internet, or one-on-one. So there's all kinds of options available. The usual door to mental health care has been through family practitioners. A lot of people don't have them, but we do have access to virtual care. And a good psychologist or good clinical counselor can also help you to differentiate between whether it's burnout or a mental illness you're struggling with.
Mm-hmm. And so can you recover from burnout?
I think you can recover from just about everything. And having treated a lot of PTSD in my life, where people have been exposed to the most horrifying traumas that you could ever imagine, and seeing people recover from that and actually come through stronger and be able to put those memories in a place where they're not controlled anymore, I believe that you can really get better and recover from most things. I will say that I don't think I've ever fully recovered from burnout, in that it's still really hard to see patients. And I have a practice, a small, very small practice, but that zest for it, that love of it, that sort of, I don't know, just the thing that was the most important thing to me of providing care to my patients. It's important, but it's never going to be the same, I don't think. So don't get burned out. Have those State of the Unions and be aware of it so that you notice it sooner.
Yeah. And, I can see the sadness on your face when you talk about it. I really can. It's there when you're talking about it. And so what I'm getting from this conversation is that we've never really considered how serious burnout can be for somebody, and the line is a bit blurry for most of us, right, as to what it is exactly. And I think this conversation has really helped, or I hope it helps people recognize what it is. And if they see any of these characteristics in themselves, that they can do something to stop it, right?
I would say I'm most concerned about burnout at this moment for our healthcare system and our mental health care system because of the pandemic and the weight of responsibility for every person living and working within the healthcare system who didn't know what was happening. Not only were they worried about their own well-being, but their staff's well-being, their loved ones' well-being when they went home afterwards, the nurses, the doctors, the respiratory therapists, everyone in that entire system, they are at risk. And I think burnout is another layer of risk within our healthcare system. These people are heroes. So are the people who worked in grocery stores, for heaven's sakes.
Yeah.
They didn't know.
They're all, they're all frontline. Yep.
All of these people who were frontline in trying to keep people healthy and alive and safe. And this is my concern, is that we need to recognize it and be aware you don't have a mental illness, but by not doing anything about it, by not trying to control the things that you can control, you are at risk of developing a mental illness. I was lucky to be able to pivot. I'm trying to make a change in my profession by not being a primary care psychiatrist, but by creating technologies and by talking to you. So doing different things to try to use the gifts that I've been given.
Oh, well, I really appreciate it. And, I know this is the first of many more conversations to come. And this is a good one, Diane. And I can't thank you enough for sharing your experience with burnout, because it really does help us understand that really it can happen to anybody, and it is happening right now. I think we all recognize it in healthcare. So I really appreciate this. And you're online still at drdianemcintosh.com, and you're on Twitter at that's Dr. Diane McIntosh. Thanks again, Diane. I really appreciate it.
Thank you so much.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.